have a great duo of presenters today, so welcome everyone to this next Translational Bipolar Research Rounds. As I was just saying to Holly Swartz, let us know if you have emails of folks that you think would be interested in this. We're happy to the more the merrier, and we always are grateful for our speakers who join us virtually. Today we have a focus on the lived experience of bipolar disorder, patient and family engagement. That you'll hear from two great presenters. I'll first introduce Dr. Andrea Vassilev, and then she'll go first for about 20 minutes, some Q&A, followed by Andrew Kcomt, who we've been working with for a long time, and I'll introduce before his presentation. So Dr. Vassilev is a doctor of psychology with specialty knowledge in and 25 years of lived experience with bipolar disorder. She brings a unique perspective as a clinician, academic, and patient advocate, person with lived experience. She's the creator of Overcoming Self-Stigma in Bipolar Disorder, which is the world's first comprehensive program to address self-stigma in bipolar disorder, and it's been implemented in mental health settings across the world and is going to be turned into a new Harbinger workbook. Personally, Dr. Vassilev is an award-winning mental health advocate who regularly speaks and writes for various online and media outlets. She works with the International Society for Bipolar Disorders, sitting on the Psychological Interventions Task Force, co-chairing the Experts by Experience Planning Committee, and recently being invited to serve on the board of directors of the ISBD. And this is, I think, for the first time ever, and just a great next step for ISBD and for Andrea. Andrea is a therapist, a registered psychological associate in private practice, seeing clients across California. And I will put her website and her Instagram handle in the chat. And with that, Andrea, thank you for joining us. Welcome. Feel free to share your screen.
Thank you so much. I have to update that bio. It's been 26 years now with bipolar, another anniversary. Let's see here. Let me share my screen, my slides. Processing. Give me a second. Let me know if you're able to see those.
We see it now.
Excellent. All right. So thank you for that introduction. Thank you for having me here. Yes, today we're going to discuss wellness and recovery in bipolar lived experience perspectives. Some housekeeping. Here are my financial disclosures. And some learning objectives. So hopefully by the end of this, you will be able to explain the concept of wellness in bipolar from a lived experience perspective. And also we're going to explore research-based recovery frameworks in bipolar. So I hope this talk is meaningful to you. So as we said, the focus here is wellness and recovery. Now, I've written these words like this, not just because they're nice to look at, they are nice to look at, but because these two concepts are so nuanced, they are so complex, and they are so individual that how one person might metaphorically write or conceive of wellness and recovery is not necessarily how someone else might. And that's a really key point. Now, I also know these concepts are a little bit vague. The terms are sometimes used interchangeably in the literature. So for clarity today, for our time together, I'm going to differentiate them as follows. Wellness is a state people try to achieve and to maintain. And recovery is the ongoing process of creating that state in the context of mental health struggles. So the traditional meaning of recovery is a little bit problematic for me, in my opinion. If you talk about like recovery from surgery or recovery from a head injury, it implies this before and after, like now you're not okay, now you're okay. Something is broken, now you're fixing it. And that's just not really how it works in mental health. So I prefer this concept of creating wellness as how we talk about recovery. And despite these being really individualized concepts and ideas, we do see themes that I think clinicians can really learn from in order to better align with the people who they are treating. But more than anything, please understand, if you take one thing away, that wellness, it matters what it means to the individual. So we want to know what that means in order to work jointly towards their goals. Let's start with what wellness is not. I really think you could ask just about anyone with bipolar, and they would agree, wellness is not just symptom remission, right? You do need a base sort of foundational amount of symptom remission in order to be able to cultivate wellness. but it doesn't end with symptom remission. Think about those studies they have about correlating money and happiness, right? So you need a certain amount of money to be able to have some happiness, but after that it plateaus, right? And at some point it actually drops off, I think. But I think that many, if not most people, myself very much included, with bipolar, they do live with ongoing symptoms, but they still manage to create wellness, and that's really key. This is some very, very informal data. So I run an educational bipolar Instagram account. And when I started writing this talk, I decided to ask my followers, maybe 4,000 followers, what wellness was to them. And these are some of the quotes that I got in response from my dear followers. Being able to manage symptoms, not having symptoms, being able to manage them. Being a little productive each day, satisfaction, not feeling ashamed. Stigma came up quite a bit in these responses, actually. Feeling optimistic. So you might be surprised to see these. These might not be the first thing you think when you think of what is wellness in bipolar. These are the answers that I got. And then we move to some more formal data, actual formal data. My colleague Emma Morton in Australia ran this study with DBSA. DBSA here in the US is the Depression and Bipolar Support Alliance, which is the nation's largest network of peer support groups. They do a lot of advocacy as well. So this is a pretty large scale study. And some of the highlights that they found are listed here. So wellness, again, from the patient perspective, is not limited to being symptom-free. People with mood disorders value, but honestly don't usually receive holistic care approaches. And both patients and researchers / clinicians may not agree on mood disorder treatment goals. That's really interesting because it's supposed to be a partnership, it's supposed to be working together. So if there's no agreement from the outset, what's that going to look like? A slight limitation here is that in this study, they didn't differentiate between MDD and BD. Some more findings, aspects of wellness that were drawn from this study: the ability to act independently and according to one's own will, experiencing purpose, getting through the day, and contentment. So the one here that stands out to me personally is experiencing purpose in my life. I always encourage people, myself, my peers, my clients, to make meaning at every step. We're going to look at this again in a couple of slides, but to make meaning at every step of life, no matter what symptoms or what course of illness looks like at that point. Oh, sorry. Clicked the wrong thing. More interesting findings from Dr. Morton's study. My goal in seeking healthcare is to function as well as possible. 94% of people agree with that. I found this so interesting because this really highlights people's priorities, right? They want to function. They want to be able to live their lives. Okay, so if you're a clinician watching this, how does this apply to your practice? Well, discuss this with the individual you're treating. What you have in mind for them may not be what they have in mind for them. And the other really important point is, not only which symptoms are worse for them, but the question of side effects, right? At some point, we have to ask which is worse, the sickness or the cure, as they say. So as a personal example, I have endured permanent side effects that were so debilitating from medication that honestly, I was closer to taking my life when my side effects were really bad than at any other point in my now 26-year history of bipolar. But people kept saying, you're stable, stay on the meds, and they refused to look at the side effects. We really don't want to get into that area. We want to listen to individuals and see what really matters to them. This is from the self-stigma program that I created. I call it the Wellness Continuum. And I think I created this because people, I think clinicians, people with lived experience, people get caught up in this idea that wellness is somehow binary in some way, right? You're well or you're unwell. You're sick or you're okay, good or bad, right? This binary black and white thinking. And that's just not how it works, right? The states of being 100% well, 100% unwell, those aren't real states. So I try to remind my clients and my peers and myself that most of life takes place somewhere in between here, right? It's so important to remember that, because if you're constantly waiting to be well, you will miss most of life. You will miss what's happening in every moment. So it's just imperative that people aim to create meaning, a meaningful life at every point on the continuum, and not be waiting until they reach a certain point to start living. This is quite interesting. I want to share a cautionary example. This is a post from my Instagram that got a lot of traction and a lot of comments. I changed the wording on this quote so that no one could Google it and identify the speaker, because they are very well known. And the point here is not to throw anyone under the bus. It's just to draw attention to this, that even some of the world's best clinicians can be walking around with this implicit bias, this belief that patients with bipolar can be really well or really sick, and there are not a lot of states in between. That's just so false. It's untrue, and it's so damaging. So if you're walking around with some of this implicit belief, I encourage you to examine it. The next piece, now we come to, what is recovery? Okay, well, as we said, recovery is the ongoing process of creating wellness in the context of mental health struggles. It's a way of living a satisfying, hopeful life, even within the limitations caused by the illness. Talk about limits again in a minute. Personal recovery refers to the process of individual psychological adaptation to the disorder. This CHIME framework that you see here is a pretty well-known framework. It was developed for serious mental health conditions. It pulled themes for recovery, how to create wellness and live well, from the literature. The population was mostly individuals with psychotic disorders, some major depressive disorder. And this is the acronym they came up with. Pretty cool. Connectedness, hope and optimism, identity, meaning and purpose, empowerment. However, here's the domains and the subdomains. You can take a quick look at that. But I can do you one better, because this team went one step further and combined the CHIME framework with research that's specific to bipolar, right? So this review aimed to answer, what do we know about the experience of personal recovery of individuals diagnosed with bipolar from qualitative evidence? And this is the framework that they came up with, POETIC, which is, if you look at it, basically the same as CHIME with the words rearranged for a new acronym, plus the addition of the domain of tensions, which is so important. Here are the domains and the subdomains from the POETIC framework. You'll see the yellow ones have been promoted to be more important, and the green ones are the tension ones that are new. So let's have a closer look at the subdomains that were promoted, because I think these are so fascinating. So the first one that was deemed even more important in bipolar was work, right? The purpose, under purpose and meaning, because work gives you both purpose and meaning. I'm sure you would all agree that in bipolar, it can be a very real struggle to maintain ongoing stable employment. But it's also so important for both structure in one's life and for a feeling of validation, right? So personally, as someone who spent about 10 years not being able to work due to bipolar, this really resonates. And, I talked about making meaning at every step. And as much as I tried to do that, I ran a food blog, I volunteered, we raised homeless kittens, right? Like, tried to do all these things to make meaning. It's still very hard to live in modern society without a career to help define you. So this is a very real area of struggle for many, myself included, in bipolar. Under empowerment, right? Empowerment comes down to like a sense of control over one's life, right? One subdomain is self-management and personal responsibility. So in my experience, it is deeply rewarding to have a sense of agency in your life, right? To have the ability to affect positive change in your world. One way to do that is to have enough self-awareness to notice warning signs of episodes, and then to leverage lifestyle changes to make a difference in your experience. That's quite positive. That's self-reinforcing. That's rewarding. So I'm not at all surprised that this was a promoted subdomain. Also under empowerment, the sticky subject, the controversial role of medication, right? So in this study, most people did identify medication as an essential factor to stay well. But let's be honest, sometimes it's not helpful and sometimes it's even harmful, right? Many find that they have to trade stability for side effects. Case in point, myself. You heard briefly about my now permanent disability due to side effects. So all of this says to me that we need more research and development in the bipolar pharmaceutical space. So if that's your space, this is really your chance to make a difference, because this is a controversial topic. It's a, no pun intended, but it's a bitter pill to swallow for a lot of people. So this new domain, tensions, this is one that was added specifically for bipolar. I think we can all agree living with bipolar is nothing if not complex, and this analysis really revealed that. So the first subdomain, balancing acceptance with limitations leads to better self-management. So limits, we talk about limits someone might have. Limits are a double-edged sword. So I personally say, live well within your limits, right? Learn to love your limits, that kind of acceptance, because they keep you safe. They help you avoid suffering. However, if you take that too far, then you see people giving up. And that's also not something we want. Personal example, I respect the limit that like many with bipolar, I really don't function well in the morning. I'm on the West Coast. This is before my usual start time for work, right? But I've had to give up like whole careers for that reason, because I didn't function in the morning. But it didn't mean I had to give up all work, just that I had to cultivate employment that works within my limits. So limits are a really important thing, but again, an area of tension. Also under tension, openness enables support, but also stigma. So if you tell people about your diagnosis, you get both formal and informal support. So you might get help, seeing a psychiatrist, seeing a psychologist, but you get informal support from your family and friends. But something we talk about in my self-stigma program is disclosure, right? Sharing can help get you what you need and what you want, but it can also cause people to see kind of everything you do through the lens of bipolar. Oh, I'm happy today. Did you take your pills? Are you experiencing mania? Right? It changes how people see you and interpret your actions. And just the diagnosis itself can lead to self-stigma. So that's a big one. And the last new subdomain under tensions is ambivalence around elevated mood states. I'm sure a lot of you have witnessed this with people you work with. There's lots of mixed feelings here, another pun not intended, mixed feelings. I think when it's 3/4 of time spent ill is spent experiencing depression, it's understandable that people crave something to balance that with, right? If someone's having classic debilitating wreck your life kind of mania, maybe with psychosis, they probably have clear feelings around that's undesirable and not something they want to sustain. But anything in between can really be very alluring because it's a change. People are hyperproductive, they get a lot done, they're energetic, right? So there's some ambivalence there, some tensions. In my personal and professional experience, someone just has to go through enough cycles to internalize that these good times that they see come with a pretty massive price tag, and this eventually will improve participation in treatment. So conclusion, we've got wellness, more than just symptom elimination, truly an individual concept, happens on a continuum, and people tend to focus on functioning and purpose. For recovery, how to create wellness in the context of these struggles, it is a journey, not a destination. And bipolar recovery specifically involves these tension areas. How can you integrate this information? Well, first and foremost, have open conversations with the people you treat. Let them identify what wellness is to them, what their goals are. Try to leverage the gifts that they innately have to support their recovery. And in the end, acknowledge, honor, and support support them through tensions and struggles that they may have. So thank you to Dr. Goldstein, Jessica Barton, the Center for Youth Bipolar Disorder, and the Center for Addiction and Mental Health for having me. If you want to get in touch and discuss further, all of my information is there. You can scan that little code for a contact card. So thank you.
Thanks so much, Andrea. That was a great overview, great slides, and enjoyable presentation to watch. You've left us with time for Q&A, so I'll let folks either unmute themselves or if they'd like to post their question in the chat, I'm happy to read it. And maybe I'll kick off as people are thinking. Could you say some more about what you're, in an ideal world, 10 years from now, what would the integration of holistic perspectives in the management of individuals with bipolar disorder look like?
Interesting. So holistic covers a lot of things, right? Holistic covers some things that already have a scientific basis and some things that maybe are more experimental, everything from diet to acupuncture to exercise, right? Some of these have more of a research base than other things do. But I think that for a lot of people with lived experience, when they pursue these, they're kind of poo-pooed by their treatment providers. I think that a really important first step would be for treatment providers to embrace that, right? To say, let's try it. If it helps, it helps. Even if we don't understand why it's helping, even if it's a little bit of a placebo, if it's helping someone, that's what matters. So I think an important first step that we might see in 10 years is having treatment providers encourage, embrace those holistic cares, and also then making them available, making them covered by insurance, right? Making them accessible, things like that.
Okay, thanks. Okay, I think we also have time for more discussion at the end. So thank you so much, Andrea. And it now gives me great pleasure to introduce our longstanding colleague and friend, Andrew Kcomt. Andrew is the Knowledge Translation and Research Manager at Hope and Me, the Mood Disorders Association of Ontario. As the co-chair of the CanBind, so this is a large Canadian depression network. So as the co-chair of their Community Advisory Committee, Andrew represents the community perspectives on the Ontario Brain Institute's Knowledge Translation, Outreach, and Communications team. He's been a longtime community partner with CYBD over the past 15 years. His interests include patient advocacy, team building, diversity enhancement, and collaboration. And just a personal note to say that it's been an absolute pleasure working with Andrew through the years, especially in collaboration on our World Bipolar Day events. Andrew, I'll turn it over to you for your slides. Thank you for joining us.
Thanks so much for that introduction. So let me open up my slides. Hold on. All right, so everyone can see that?
Yes, we can.
Perfect. So thanks so much for that introduction. So a little bit of the background about the organization that I work with. So we've been around for almost 40 years now. So Hope and Me has been, supporting people living with mood disorders, as well as caregivers and family members. And we focus very much in terms of the transformation, transformative power of peer support. So we have many great peers and volunteers who like to listen, empathize, and inspire hope. And we definitely believe that talking to someone, our motto basically is talk to someone who's been there, because basically every single staff member, volunteer, board member has either lived with a mood disorder or has been a caregiver with someone living with a mood disorder. So we definitely believe that sort of talking to someone with lived experience with the mood disorder provides like some invaluable resources to help others with similar diagnoses to kind of recover and lead a very healthy life. So we strive to offer a lot of really great peer support programs, clinical programs, and services for people living with mood disorders across the province of Ontario. I'm excited to discuss some promising approaches in managing bipolar disorder through peer support and also some online self-management programs. So previously we had our office and we offered in-person services at Yonge and Eglinton. But after the pandemic, we've moved mainly, we have a bit of a hybrid model, but we offer a lot more virtual and online self-management programs. So during this presentation, I'll review findings from two studies, one examining the effect of peer support as an adjunct to online psychoeducation, and the other one will explore how online self-management tools can be optimized for those living with bipolar disorders. And these studies reveal some valuable insights on how you can kind of better support patients in managing their condition. So in terms of the learning objectives today, we'll be identifying the role of adjunctive peer support in managing bipolar disorder, describe some of the benefits of online psychoeducation and self-management strategies for patient engagement and outcomes, and discuss strategies for optimizing online program delivery to improve accessibility and impact. So basically, as everyone knows about bipolar disorder, but one thing that's kind of very important to mention is that sometimes these mood cycles can sometimes be unpredictable and create challenges for long-term management and sometimes can lead to relapses. But not only are these mood shifts difficult to cope with individually, but as Andrea also mentioned, it can impact things like areas of employment, your relationships, and your daily functioning. And often people feel a lack of control over these changes. And that can definitely foster a sense of helplessness or perceived lack of agency in their own personal recovery. So, what's really important is there's definitely a high need for ongoing self management, given the recurring nature of bipolar disorder. Effective self management strategies are very essential. So, self management encompasses a range of different practices including monitoring one's mood and symptoms daily in terms of implementing different lifestyle changes that can help reduce mood triggers. So things like maintaining a regular sleep schedule, managing your stress levels. And a lot of the research indicates that patients who engage in consistent self-management tend to have fewer relapses, experience less severe mood episodes, and generally report a better quality of life. However, it's kind of really important to note that it requires substantial commitment, motivation, and often a network of support. So that's why peer support matters. So peer support includes having connections with individuals who have experienced similar struggles, and they can play a very significant role in the self-management of many chronic conditions, including bipolar disorder. So basically, this essence of peer support lies in your ability to offer sort of a very unique, relatable form of personal guidance. So in terms of traditional psycho education, while that can be very informative, sometimes it might lack that personal touch and empathy that comes naturally from someone who has quote unquote been there. So in terms of the benefits of peer support in mental health, it has been proven to be beneficial in enhancing things like motivation, improving your social connections, and foster a greater sense of self-efficacy. And patients who engage in peer support often report that they're feeling less isolated, more understood, and more hopeful about managing their illness. So these connections can help normalize their experiences and reduce those feelings of stigma or shame associated with the condition. And they can also see firsthand how others have successfully managed similar symptoms. So in terms of an adjunct to psychoeducation, this background kind of sets the stage for exploration today into how peer support, when used as an adjunct to psychoeducation, can potentially add additional value in managing bipolar disorder. So the idea is that peer support could supplement things like virtual psychoeducation by providing that emotional, motivational, and practical support layer that enhances the effectiveness of educational content rather than doing it alone. So basically, we'll examine whether integrating this personal connection can improve patient outcomes in areas like illness perception, personal control, overall satisfaction with the management of that program. So basically, in summary, bipolar disorder requires a high level of self-management, which can oftentimes feel very isolating and challenging for many people living with bipolar disorder. So what peer support helps is that it can sometimes bridge gaps left by traditional psychoeducation by providing sort of a unique but complementary source of empathy and encouragement. So I'll talk about the study. It's actually called The Effects of Adjunctive Peer Support on Perceptions of Illness Control and Understanding in an Online Psychoeducation Program. So basically explored the impact of adding peer support to an online psychoeducation program for adults living with bipolar disorder. It was a randomized controlled trial separated by participants into 3 groups. One just receiving psychoeducation alone. Another one where they're receiving both psychoeducation in addition to peer support. And then there was another control group where they're just kind of given very kind of brief messages over 8 weeks. And the main outcomes that they kind of measured within this research project were the participants' perceptions of illness control, their understanding of bipolar disorder, and their satisfaction with the program. And the aim of this study was to assess whether peer support adds measurable benefits beyond traditional psychoeducation in an online format. So, in terms of the study findings, while there were no significant treatment effects observed between the control group and the online psychoeducation program, the study did find that there seemed to be a greater adherence to the online program when participants received additional supports from a peer support worker. There were no significant differences between the groups on outcome measures, but what they did find was that there was a small clinical difference between the supported and unsupported participants in their depression symptoms and also in their functional impairment when they did a 6-month follow-up. Adherence to the treatment program they found was significantly higher in the peer-supported intervention rather than the unsupported group. So basically, these findings suggest that an intervention of potentially maybe longer than 8 weeks may be necessary to obtain more of the significant benefits for patients with bipolar disorder. And the findings also suggest that potentially additional coaching and support throughout the online program for bipolar disorder may help to increase things like compliance and also long-term symptom and functional improvement. The study findings also showed some benefits for the group receiving peer support, and the participants reported a stronger sense of control over their illness, potentially because they could observe different types of role models who had successfully managed their similar symptoms. Additionally, their understanding of bipolar disorder improved, likely due to kind of that shared relatable experiences from peers who had that kind of firsthand knowledge of managing the condition. In terms of the implications of peer support, So this study may have some practical benefits in your personal practice. So the enhanced sense of control and understanding seem to increase self-efficacy, which is crucial for managing a condition like bipolar disorder. So self-efficacy, or the belief in one's own ability to manage their own health, is crucial for those living with the condition because that condition requires sustained self-management. And how peer support helps is that they can help support clients by observing real life examples of others that have been able to effectively manage their symptoms. And these shared experiences can often make people feel less alone, and they can manage and handle similar challenges, and it actually can empower them to take a more active role in their own health. So peer support also seems to enhance a person's sense of control over their illness. And this can be linked to people feeling more validated and encouraged by their peers who have faced similar issues. And feeling control is especially important for people living with bipolar disorder because with fluctuations in their moods, that can sometimes lead people feel like their bipolar disorder kind of controls them rather than the other way around. So by reinforcing those positive coping strategies and symptom management techniques, peer support can actually help shift this perception, and it provides a sense of more stability and mastery that can be hard to achieve through doing kind of psychoeducation alone. In terms of program engagement and adherence, some of the patients receiving peer support might be more likely to complete the program because they feel more connected to others and feel more motivated to return regularly. And this is important since consistent engagement in psychoeducation can be linked to better health outcomes. They've been found that it can help reduce hospitalization rates and overall mood stability in bipolar disorder. In terms of considerations, if you're planning on implementing these types of programs, these findings also highlight the need for careful planning when integrating peer support into psychoeducational programs. So not only must you kind of select and train peer support workers, it's important that they're able to effectively communicate. But we also need to consider matching clients or patients with peers who have similar backgrounds or illness experiences to maximize that relatability. And that personalization can increase the impact of peer support as patients may find it more helpful to connect with someone whose journey closely mirrors their own. So basically, in summary, the implications of integrating peer support into online psychoeducation for bipolar disorder may add some value by enhancing self-efficacy, improving satisfaction and engagement in these types of programs, and may potentially contribute to longer-term stability. And the data suggests that peer support is an essential component that can help kind of reshape how we approach psychoeducation for people with bipolar disorder. So in the next study, this second study is a review titled Optimizing Delivery of Recovery-Oriented Online Self-Management Strategies for Bipolar Disorder. And this review examines some of the core self-management practices such as symptom monitoring, psychoeducation, and goal setting, which are very kind of essential components for managing bipolar disorder. And the study's primary aim was to assess how these strategies are currently delivered in virtual or online programs, and to identify areas where delivery may want to be more optimized to support patients better. And there's been more of a growing evidence base of the value of self-management. Effective delivery models are crucial for ensuring these tools can reach and benefit those who need it the most. So in terms of best practices for delivery, as you can kind of see on this slide kind of focuses on some of the best practices identified in the literature for identifying effective online self-management programs for bipolar disorder. And essentially, the goal is to ensure these programs are accessible, adaptable, and truly supportive of people living with bipolar disorder. And each of these recommended approaches addresses some specific needs that can help self-management strategies become more practical and sustainable for those living with bipolar disorder. It was also important for user-friendly design for accessibility. It's first up, having a user-friendly design is very essential. So for people with bipolar disorder who might experience maybe sometimes cognitive challenges during mood episodes, like maybe sometimes difficulty concentrating during depressive episodes, or feeling impulsive during a manic phase, accessibility is very crucial. So the program should be designed in a very kind of simple, intuitive layout that's easier for patients to navigate and engage with consistently, and can help reduce frustration. So features such as straightforward navigation, easy access to resources, a clear visual structure can help users focus on content without feeling kind of overwhelmed by different technical barriers. And this lowers the likelihood that patients will abandon the program due to usability issues. It's also important to try your best to be flexible and customize. So the next best practice is flexibility customization. And oftentimes people with bipolar disorder often have unique symptoms, triggers, different coping styles, and what might work for one person might not work for another. So having more of a flexible program allows users to tailor their content to their needs, help them focus on what's more relevant at any given time. Customizable elements can include tracking options for specific symptoms, personalized goal setting modules, or the ability to choose the pacing of the program. This flexibility actually increases the program's relevance and make it more likely that users will remain more engaged and benefit over the long term. In terms of peer and professional guidance, another effective approach is to incorporate a mixed method support, combining both peer and professional guidance. So professionals can provide evidence-based information and structured guidance, but oftentimes peers can often offer relatable insights and emotional support that can help foster motivation and engagement. And peers can often also offer a unique layer of empathy and encouragement, while professionals can address more of the complex or technical issues. So working together through this balance creates more of a well-rounded support system that meets both their educational and emotional needs. And this dual approach is particularly valuable in oftentimes online formats where personal interaction can sometimes be limited, and the risk of feeling isolated can be higher. In terms of getting participant feedback, it's important to try to look at a continuous improvement model. We're getting continuous participant feedback, and that can't be overstated. So oftentimes mental health needs can change over time, especially with bipolar disorder with its cyclical nature. So trying your best to get regular feedback allows program designers to make the necessary adjustments and improvements based on the real user experiences. So that feedback can cover things like the program structure, the usability, the content relevance, and try your best to incorporate that user suggestion enables the programs to evolve and stay aligned with their needs. and ensure that the program remains both practical and appealing. And that adaptability is essential for maintaining higher engagement rates and achieving sustainable outcomes. And so when you're integrating it thoughtfully, these elements can make a significant difference in how clients can engage and benefit from online supports for managing bipolar disorder. And such conditions can also improve the scalability of these programs, making it easier to reach a much wider audience without sacrificing the quality or personalization. So in terms of implications of optimizing virtual programs, some of the key implications in terms of self-management programs focus on these enhancements to impact accessibility, engagement, and overall quality of life. So one of the primary advantages of optimizing these programs is improved scalability, which makes them accessible to a wider audience. Despite the fact that we're a provincial, nonprofit, we have a very kind of small number of staff and lots of volunteers, but it's difficult to kind of reach remote or underserved communities. But now that we've moved into more of a hybrid model, we're able to reach a wider audience, including those in areas where there's limited access to specialized mental health services, particularly in the Indigenous community, rural or low resource regions. So it's important to optimize self-management programs to be more accessible and user-friendly, and they can be scaled more easily by extending vital support to people who otherwise may not have access to mental health services. And online delivery can actually help bridge some of those geographical gaps and provide access to peer support and psychoeducation without the need for in-person visits, dealing with the TTC or the traffic that's happening in Toronto, which is often not feasible or affordable for everyone. It can also help increase patient engagement through personalization and flexibility. So one important implication is the potential for increased engagement. So having customizable, flexible programs allow individuals to tailor the content and pacing according to their personal preferences and needs by creating more of a meaningful, relevant experience. And engagement, particularly in bipolar disorder management, having regular and consistent participation in self-management activities is often correlated with better health outcomes. When users feel more empowered and the program is personally relevant and flexible enough to fit into their own personal lives, they're more likely to remain actively engaged over time. And this flexibility can help them manage their symptoms more effectively and more sustainability. There's also the potential for enhanced mood stability and symptom management. So optimized programs are easily accessible and engaging, that are more easily accessible and engaging, are more likely to support long-term mood stability and symptom management. So there's some studies that have shown that consistent use of self-management strategies, such as things like mood tracking, early symptom identification, managing stress, can contribute to fewer mood episodes, reduce symptom severity and lower relapse rates. While patients have access to optimized tools, it can make it easier to monitor and respond to their mood states. And they're often better equipped to manage their symptoms more proactively. And that not only helps in preventing episodes of things like depression or mania, but also contributes to a better quality of life by promoting stability. Also, for persons living with bipolar disorder, improving quality of life means reducing the impact that mood episodes have on their daily functioning, relationships, work, and overall well-being. So optimizing online self-management programs can play a very critical role by providing structured, accessible supports that make people feel more in control of their condition. And with these tools, they can enhance mood stability and self-efficacy. They can help build resilience and maintain greater control over their day-to-day, in terms of their day-to-day functioning experiences, which can oftentimes have a profound effect on their overall sense of well-being and life satisfaction. And lastly, optimizing these programs to be more accessible and engaging can also support ongoing clinical care. So by integrating things like symptom tracking, mood monitoring, these types of programs can facilitate better communications with healthcare providers. Patients can share progress reports, mood logs, flag symptoms with their mental health teams, allowing providers to make more informed decisions about treatment adjustments and interventions. And this continuity of care, even between clinical visits, helps create more of a comprehensive support system, enhancing both the effectiveness and responsiveness of overall care. So basically, in summary, optimizing online self-management programs for bipolar disorder can have some far-reaching implications that go beyond accessibility and engagement. And it can support a more proactive approach to symptom management. It promotes a higher quality of life and complements ongoing clinical care. And it makes it a crucial part of more of a modern, holistic approach to managing bipolar disorder. And by addressing these unique challenges and preferences, these optimized programs can empower patients to lead more stable and fulfilling lives. So in terms of some of the practical considerations of integrating peer support, while the benefits of integrating peer support in online psychoeducation is clear, there can be some challenges in effectively implementing these programs. So I'll talk a little bit about some of the obstacles and how we can kind of address them to address the success and sustainability of these interventions. So first thing to mention is maintaining the quality and consistency of the peer support programs is very crucial. So peer support workers often bring very diverse personal experiences. And oftentimes, while this diversity can enrich the program, sometimes it can create variability in the quality of their support. And some peers may oftentimes may provide strong constructive supports, while others may need guidance to avoid offering unhelpful or potentially harmful advice. So at our organization, we offer very intensive training and also a regular community of practice. We also have clinicians or staff if they need to kind of debrief or have a client that may need extra supports. So that training and supervision is very essential to equip peer supporters with the skills so they can offer meaningful support and safe interactions and provide more of a consistent experience for all participants. However, some training requires resources and ongoing evaluation that can be sometimes challenging to scale in an online format. Another kind of challenge in implementing these programs is to ensure privacy and confidentiality. So while online programs inherently involve sharing personal experiences, it's important to make privacy as a top concern. So sometimes participants may hesitate to engage if they're uncertain about who can access their information or worry about potential breaches. So implementing secure encrypted platforms and having clear privacy policies is essential. So you can create a secure communication platform that allows people to interact freely, knowing that their information is protected. Sometimes it can be difficult in building trust in an online environment. And building trust is often easier in face-to-face settings where you can sort of notice someone's body language, tone, and that can contribute to a sense of safety. So in online settings, particularly when sometimes communication, they're doing it by text, it can be challenging for participants to feel a stronger connection to peers. And they may be, sometimes people feel it's difficult to express them fully or might question the sincerity or the understanding of others. So one potential solution is having these regular peer support groups, maybe doing an icebreaker that can help to establish a foundation of trust amongst the participants. Also, it's important to have that balance with peer support with professional oversight. So that balance between peer-led and professionally guided support can sometimes be another challenge. While peer support offers unique benefits, sometimes they may require professional intervention. And that's why we often also always have a clinician or another staff member as a backup person. And finding that right balance between peer-led interactions and access to professional supports can sometimes be a bit tricky. But ideally, these programs should include clear guidelines when you may need to escalate a client to a healthcare professional.
Andrew, sorry to jump in. I think we're just gonna have to wrap up. Time has gotten away from us a little bit.
Oh, sorry.
No problem. I just wanted to make sure that I got in a thank you to you and Andrea again for this great pairing of presentations and for giving us this comprehensive overview with so many convergent themes among them. So I hope this is the beginning of a discussion. I hope that it's thought-provoking for people that may not be, chin deep in this as you guys are. And I also wanted to just point out that our next Toronto Translational Bipolar Research Rounds will be on January 16th, 2025 at noon again. And we have special guests, Dr. Brenda Pennings from the University of Amsterdam and Dr. Jess Fedorowicz at the University of Ottawa. They're going to be presenting on mood, vascular, and metabolic associations in bipolar and other mood disorders. So thank you everybody for joining. Thank you, Andrea and Andrew, and I look forward to seeing you in January. And before then, have a happy New Year and good holiday.
Thanks, everyone.
Thanks.